Maybe you think cancer patients die because of cancer, but it's not the only reason. Many cancer patients die because of infection. And maybe you think which kind of infections, like cytomegalovirus, Epstein-Barr virus, adenovirus, or many other infections, microbial infections, or totally virus infections, fungal infections, and this is a very important reason of death in cancer. And when a cancer it starts growing in body, firstly it starts from a cell, a normal cell. You have a normal cell, and it has infection, it has mutations in it, and after mutations, the standard mechanisms in cell cannot repair it, and one cell becomes cancer cell. And after a while, it needs too much oxygen, it needs too much fuels, nutrients, and it needs too much energy. And after that, it grows around it. We have now some cancer cells, and after a while, the first tumors, we see the first tumors, and the first tumor then grows, and by angiogenesis, by metastasis, can expand in body. But what's important, while this procedure, the immune system can protect body around all bad things happening in body, in cancer condition, I mean. But after a while, the immune system become tired or exhausted. So the exhaustion happens in immune cells, like T cells, like NK cells, or natural killer cells. And a type of T cell, it's T8 plus, is a killer T cell. It is against cancer cells, against infected cells, and also NK cells are natural killer cells, are very important cells in immune system against T cells, against infection and cancer cells. And when they become exhausted, so the immune system gets blocked. And when the immune system gets blocked, now infected cells, or totally infection that was controlled until that time, can show itself. Maybe most of us had experience with infection with CMV or cytomegalovirus, but it was controlled in our body. It was controlled in our body. But in cancer condition, especially in chemotherapy phase, that the immune system is suppressed, that's a good condition for these viruses, these microbes, and they can cause death in patients in many cases. If they won't be controlled. And when it happens, physicians consider some different drugs, antiviral drugs, to work against this condition in body. But sometimes patients' body become resistant to antiviral drugs, and in that case, it grows and maybe kill the patient. So there are some novel therapeutic techniques for controlling this bad condition in cancer patients' body. One of these techniques is adaptive T-cell therapy that is worked very well, and there are many articles in this area. Also, my PhD thesis was about adaptive T-cell therapy. T cells can be targeted against one virus or more than one virus, and monospecific T cells and multi-specific T cells we have in these two conditions. And these T cells can empower the patient's body immune system against infection and control this infection. But it's not a routine technique around the world, because it needs it's expensive technique. And expert people should work in this procedure to make these cells ready. And cell therapy physicians can do it, and PhDs in cell therapy can do it in some parts of this procedure. And keep in touch with me. I will upload other videos and talk about different topics in medicine, in applied cell sciences, and other articles and other news. So subscribe me now, do it please. And keep in touch with me. I like you so much, and I wish the best for you. Bye bye. I'm in traffic man. I'm in traffic,